The VA announced their biggest restructuring ever. This is going to have impacts to the VA and the veteran community, and I want to bring all of those to you so that we can discuss pros, cons, and what you should be concerned about, if anything. Right off the bat, this is the Veterans Health Administration only. This is not like the cemeteries and benefits. This is the Veterans Health Administration that's being restructured, right? This is going to impact over 1,300 facilities and millions of veterans across the country, though. And this is both VA-run and community care facilities, which is all-encompassing, essentially, in the health side. Before we get too far into this, don't fret about changes to your clinic next week. This is a structural revamping, and it shouldn't necessarily impact the way you feel day-to-day life, but it's going to also be really polarized in the media, and I don't know, it could have some effects. So let's talk through it. The biggest change right here is VISNs, which is VISN, which is a Veteran Integrated Service Network. Veteran Integrated Service Networks are going to be cut from 18 to 5. So right off the bat, these VISNs, as I'm going to call them, VISN, are going to be cut from 18 service networks to 5. And I know that sounds scary, but let's see. These will now be directly reporting to the Secretary of Health, and it also eliminates the COO for the Veterans Health Administration. So this is kind of a top-down restructuring of like, hey, instead of 18, we're going to have 5. They're going to report to the Secretary of Health. We don't need a COO running the VHA. So now the central office is going to control things like policy, financial oversight, and compliance. So this is more top-down command we're eliminating a lot of the middle layers here that muddy things up and delay things. If you're wondering why this is happening, internal reviews have been saying this for 10 plus years. There's overlap, there's redundancy, there's no consistency by region, there's bloat, for lack of a better word. There is bloat in the VA system, and they are trying to get rid of the bloat. If everybody's in charge of everything, nobody's in charge of anything. Hope that makes sense. If you've ever been around the government, you understand what I mean by bloat. Denied again? Flying solo is like trying to shoot qual blindfolded. I'll connect you to the pros who actually get you rated right. Scan the QR code and get professional help today. Now, a little bit of backstory, and I'm just going to read this to you guys. The VISN, which again is that Veteran Integrated Service Network, they were created in 1995 to decentralize decisions. So they were meant to have 12 staff per VISN, and they were going to help decentralize decisions. Now, each one has bloated from 12 original employees to 500 plus employees across all 18 of these, right? Now, I'll tell you what, 500 people in a group trying to do the same thing that 12 were originally intended to do, I can see where the problem might be coming here, right? Now, there's different VISNs, but they pay different. Like, they have different pay structures, different approvals, different standards. So, like, if you hopped from VISN number 3 to VISN number 7, it would be a whole different world as far as compensation, approval, standards. Like, it would not be a uniform operation. And even the watchdog said that there was no accountability, unclear roles. Like, this wasn't decentralization. This was bureaucracy breeding bureaucracy. This was the government curmuddling everything like they do best, right? This is what happens when everybody gets a job. You get a job, you get a job, you get a job, and all these people retire and go government contract. This is not how you would run an organization at a franchise level or the corporate level where you're trying to increase margin and improve how your company runs. This is how you run a company when it's the government and they can afford it, and you just bloat, 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 bloat. Now, the VA is saying that there are going to be no layoffs. They're saying they're going to cut 25,000 vacant positions, right? These are a lot of COVID-era positions they're vacant, and they're basically just going to say, hey, we don't need to fill these. So it's not that they're necessarily laying off so much as saying, we're just not going to try to hire these roles that we don't need, obviously. So in theory, no impact to care. Now, the reality is that the vacancy reports are probably outdated. They say they have 7,000 plus nursing vacancies and 2,700 plus doctor vacancies that are still unfilled. And the VA lost 30,000 plus employees or staff earlier this year, right? So I think what it is really is there's just a lot of confusion and gray area in here that we're trying to cull the herd on. So again, no layoffs, while intending to mean no impact to care, it may not. So pay attention to your wait times, your lead times, and kind of see what's happening in your local area. I personally have not yet noticed anything, but it's also very early in the game. Which leads us right into the timeline of this, right? Nothing's going to change today. Now, the reorganization is going to happen or begin happening in early 2026, but it's going to roll out slowly over the next 2 years. So time will tell exactly how this changes things. Now, I would expect a little bit of confusion, a little bit of policy lag, a little bit of delays before any improvement. As with anything, there are going to be growing pains here, but that doesn't mean we should judge it right off the bat. And again, like anyone promising instant fixes just doesn't really understand how the government works. This is going to be slow and painful. Now, there is a pretty big change to the community care, right? So 40% of VA care is already outsourced, right? A lot of people go on referrals and outsource. So they're going to take the community care and they're going to take it from 5 regions to 2 for those contracts to, again, try to make things less bloated, which the new contracts supposedly could total over $1 trillion in the next decade. Right now, again, this is a big operation. That's not like one guy's getting $1 trillion in the next decade. This will open up more private providers beyond just TriWest and Optium, right? The hope here is to open up more opportunities here, which should give better oversight. And this should help with like 12-month authorizations, no second doctor sign off. Like they're trying to make this process simpler. So instead of needing like 3 signatures and a 12-month wait period to get a referral, we can speed this up to go see some other people, right? That will help with the bloat and the overwhelm at the VA. And if this works, and you'll know this works, if you quietly begin getting better care without having to step foot at the VA, meaning you can go and see the referral, the community care, and everything else. This is what veterans have been wanting. Like, I hear people all the time talk about pros and cons of all this stuff VA, and one of the biggest things I hear is people saying, why can't referrals be easy? That's what they're trying to improve. Let's make referral process easier. Now, to be fair, there's probably ways that this could have been different because it was a lot of political decision-making rather than necessarily veteran decision-making. And so there are some veterans who feel like, hey, why are we not getting the chance to help revamp this? But, you know, there's pros and cons to that argument because I'm a veteran and I'm in business, but I'm not a politician. So, like, I don't understand that side. They might not understand the business side or the veteran side. Like, no matter what, I promise you that they try to do, my assumption is they try to do the best they could to kind of group together experts to make this a reasonable decision. Before we go and politicize this is not right versus left. This is veterans versus inefficiency. That's what we're trying to do here. Make the VA more efficient. Cutting layers can help, right? But it's going to be dependent on like accountability being enforced, bad leaders getting replaced, not promoted. And this is going to be measured on veteran outcomes rather than just VA press releases. So this is going to be kind of a let's see how it goes and improve as we go process like anything else. It could really dramatically improve care. It could also just be, hey, we rearranged the org chart and somebody got an award. Right? Who knows? If you really want to see how this is impacting, watch your appointments, track your referrals and delays, document problems during the rollout, compare notes with other vets, right? And see what you actually see and feel going on in the community as this changes. There are going to be growing pains, but my hope is that by taking this overbloated, decentralized BS and actually decentralizing it to make decisions top down in a more streamlined, efficient fashion, that this will actually end up helping veterans down the road. Time will tell, right? And just as a note, I love you guys. VA means well. I know there's a lot of negativity that goes on around the VA, but I will say this. It is the absolute best care. Like, no country takes care of their service members and vets better than the United States as far as benefits, VA, and everything. It's not perfect, but they're doing the best they can to continually improve. And if you ask someone from 20 years ago about the VA today, you'll get a much more optimistic response than if you just listen to the news, right? So they are doing the best they can. It's not perfect. It's improving. Let's see how good it gets.